Well, when lawmakers gather at the state capitol this week, they begin a legislative session that will address some very familiar themes: tax cuts, worker compensation, education, and even health care. And while many of the issues may be the same as in years past, those addressing them will be quite different. House Democrats are down to their lowest level in state history. And on the House Republican side, they will be led by a speaker who at age 34 is not only the youngest, but also the first black person ever to serve as Speaker of the House here in Oklahoma. Speaker T.W. Shannon, along with the President of the Oklahoma Senate, Brian Bingman, as well as the House Minority Leader Scott Inman and Senate Democrat Tom Ivester, were all in attendance at the State Chamber's legislative preview, where the lawmakers on both sides of the aisle agreed on a number of issues, except one: how do more Oklahomans get health insurance? Last spring, Governor Mary Fallin turned down federal funds that would have expanded Medicaid coverage for the roughly 150,000 uninsured Oklahomans who make too much money to qualify for federal health care help, yet don't make enough to afford health insurance on their own. And while other Republican-led states have chosen to receive the federal help, as of now, Oklahoma Republican leaders are steadfast in refusing the federal dollars, much to the dismay of House Minority Leader Scott Inman, who told a packed audience at the State Chamber event the decision is going to cost Oklahoma hospitals more than $600 million in uncompensated health care costs.
You can't say, well, we think the federal government ought to stay out of our lives here, when it was a 14-to-1 match. $1 for every 14. We spent $1 for every 14 the federal government would have given us. We said no to that. But we take $425 million a year for our roads and bridges from the federal government. And I don't think anybody in this state, in this room, or in this state would say, let's give all that money back. We are already a recipient state. We give, for every dollar we give to the federal government, $1.47 comes back to us. So if we're going to be, I guess, genuine in this and say we don't want to cover our uninsured, then we need to give back all of that federal money to where it's just a one-to-one match. Of course, that's ridiculous. We had an opportunity with accepting the Medicaid dollars and establishing our own exchange, which Governor Fallin has essentially said, President Obama, come into Oklahoma and do it for us, by refusing to set up our own exchange. But we had an opportunity with accepting that $3.6 billion over the next 7 years to cover the uninsured, to reduce costs for our hospital associations, to reduce costs for our doctors. It would have created an estimated 10,000 jobs. It would have brought in nearly $30 million in new tax revenue. And we say, well, we can't afford the $40 to $100 million extra that it would cost us to cover these folks when this finally takes full effect, and we have to pick up about 90% of the cost. Well, I can tell you now the Insure Oklahoma program would have become essentially redundant. We already have money lined up for that could have been used to cover this, as well as the new tax dollars that would have been made through the creation of those 10,000 jobs. We think that was the smart way to go about it, and my caucus is going to do everything we can to work with the business community who truly believes it was the smart decision to accept it, not reject it, to hopefully convince the governor to change her mind and the legislature to do the same so that we can accept that money and move the state forward.
But as you may suspect, the leadership in both the State House and Senate do feel a bit different. Senate President Brian Bingman.
We've got to learn in Oklahoma, which I think we've done a pretty darn good job of, is taking care of our own problems. Insure Oklahoma, I think that's something that it's been successful, and we need to look at ways that possibly we can expand that in Oklahoma and trying to deal with the issues at hand, keep them in Oklahoma.
What I fundamentally believe is that we cannot wait for the federal government to lead, whether it's in the area of health care, education, public safety. Washington, D.C. has proven that it is either incapable or unwilling to meet the needs and demands that this country requires. If there's going to be reform in this country, it's going to happen at the state capitol. And that's why what we do now, the decisions we make over the next few years are so critically important. And so the idea that we would compare this massive takeover of health care to a core function of government like roads and bridges and infrastructure, I think is asinine.
I'm confused. I'm a numbers guy. At the end of the day, you can make arguments that if we accept the Medicaid expansion and accept the money, that the feds may lower the rate at some time in the future, thereby sticking the state. You can say that theoretically, but realistically, it's a 100% match for the first few years, and it's capped At the most the state would have to pay would be 10%. And you can say, well, they can change that in the future, so let's just don't accept it. I talked to the hospital administrator from Hobart the other day. He said, well, one of the provisions of Obamacare was they're going to lower the Medicare reimbursement rates. And that was supposed to be made up for in the Medicaid expansion. He said the majority of our patients here in Kiowa County at the hospital here are Medicare patients. So if they lower our reimbursement rates to Medicare, we're going to be getting less income, but we don't get the benefit of the Medicaid expansion because the uninsured are still coming in. He said, this is a no-brainer. This is going to hurt our hospital.
And while lawmakers may disagree on this issue, in general, they reach consensus on most everything else, especially the need for a well-trained workforce in Oklahoma.
If you look at the national average, about 1 in 4 people, 23.5% of people, have a college degree. In Oklahoma, that number drops to about 19.6% based on some estimates. In my quadrant of the state, southwest Oklahoma, that drops to about 16.8%. There is a direct correlation between the number of college graduates that you have and your per capita income. If we want to improve the per capita income of the state of Oklahoma, we have to have a better educated, more educated workforce. Where we have fallen short, I think, is a cultural change across the state and across the nation in that we have continued to value just being college educated. And while that's important, we need to also celebrate those people who are willing to garner skills that will help them to earn a living and to be ready to be productive citizens the minute they leave our educational systems in the common education system. So you bet it should be a priority, but we need to get out of the mindset that everybody has to go to college or everybody will go to college in order to be successful. It's just not true. In fact, I was talking to a welder not too long ago. He said he could fill 19 welding positions right this day in the oil field and start paying them about $65,000. That's a great living. I don't care where you live in Oklahoma, and we need to be encouraging people through our career tech systems, and we need better alignment in our educational systems as well to make sure that we're producing kids that are ready to compete, not just in Oklahoma with Texas or Arkansas, but who are ready to compete in a global marketplace.
Folks, if you want to get businesses to relocate to Oklahoma, you have to come to them and say, no, we've got 25 or 30% of our adult educated population with a college degree. It can't be at 19 or 20%. So we have to continue to focus there. But at the same time, our legislative priority at the Capitol has to keep a focus on career tech. You know, over the last 4 years, career tech has seen about a 15% budget cut. 15%. This last legislative session, there was $300 million more put into the budget this last session than there was the year before. You know how much went to education, common education, career tech? Not $1. Not $1. Not one new dollar went into those programs. So if we really are going to focus on a career tech system, which I believe is one of the crown jewels that the state has to offer around the country, then we need to make sure we're investing in it at the state capitol, and that's what you'll see us advocate for this next session.
I maybe have a little bit different perspective because I'm out in western Oklahoma, and at least in the counties I represent and up in northwestern, we're booming. It is absolutely booming. It's a full-fledged oil boom. We can't find enough workers. We can't find enough people who can pass a drug test and go get a commercial driver's license. We can't find enough welders. I've talked to the career tech in Altus, and he can get every graduate from his aviation mechanics program a job. We don't have the workforce, and that stunts growth. It really does.
I think career tech and the education community need to work together. So many kids that go to college, they drop out, and I think we lose a lot of those dropouts when they can be circulated back through career tech and retrained. You talk about mobility. Career techs have been fantastic about changing to the needs of the business community, and I think we need to embrace that and really make sure that we're doing a better job of making sure the students are aware of all the opportunities out there. Besides being focused strictly on college education, there are other opportunities out there that you can make an excellent living.
Last session, a proposal to cut Oklahoma's state income tax rate went unceremoniously down in flames over a disagreement on whether a reduction in corporate tax breaks should be how we pay for those cuts. And with more proposals to lower the state income tax this session, it's an issue that all 4 lawmakers believe will come up once again.
If you want to lower tax rates, you have to close loopholes and deductions. So a lot of these incentives were kind of lumped into that and saying, you know, are they really bringing business to Oklahoma? Or is it just a giveaway to corporations?
I think it's important that we do have incentives and make sure that they're accomplishing what they were set out to do, creating jobs, creating opportunities. We're competing with other states for new jobs, and don't kid yourself, they've got incentives out there. Also, I think Texas alone, they give out about $19 billion worth of incentives every year. So we've got to be competitive. We're competing in the job market. So again, we need to look at them, make sure that they're doing what they were supposed to do.
But I think it's real simple. We need to know what's the return on investment that we're getting for the incentives that we offer, and I think that will give us a clear definition of what's our competitive advantage and what's our core, really what's our core service that we want to offer.
Now, in addition, the legislative leaders also address issues surrounding the ongoing debate over water rights issues, crumbling infrastructure, including the deteriorating Capitol building, as well as the need to streamline state regulations and the Oklahoma's workers' compensation system.